Good day, F6 10 audience. Thank you for joining us today. Today we have a special guest. I'm going to introduce Lini, who is a mother who needs to face a life-changing situations due to the condition of her daughter. So I will pass the sessions to Lini to share more as we are going to hear her testimony. So Lini, I pass the session to you.
Hi, my name is Lini. I'm a mother of two. I have a daughter, 11 years old, and my boy is 9 years old. I was an accountant and became a housemaker since my boy was born. About 4.5 years ago, my daughter was diagnosed with ADEM. It stands for Acute Disseminated Encephalomyelitis. It is a inflammation in the brain and damage the nerve systems. The first symptoms was unsteadiness of walking, loss of balance, and loss of control over her body. Initially, she complained pain when she was walking. Then within a few days, she can't walk. She can't even hold up her neck. So for us, please do not take it lightly when our children feel something wrong with their body. In the following sessions, I will elaborate more on the treatments and taken and selection of doctors and preparation of schooling, because at that point of time she was prepared to enter the primary school in Singapore. And the therapies recommended and taken and impact to her progress.
Okay. Thank you, Lini, for sharing this. Thank you for sharing your vulnerability as well. I'm sure this sharing will give a lot of values to those parents, especially those that are facing similar situations, because your experience not only benefit those that have similar sickness, similar illness, but also those that have to go through to take care of the special needs children. So just now you mentioned, back to your point about your sharing, just now you mentioned that she started to not able to walk steadily. So when did it happen again for that?
It was happened 4.5 years ago. Initially, she complained pain when we think back, actually the earliest symptom was she cried every night after she slept without any reason for about 1 week. At that point of time, we have no clue. So we try to find out what happened at school, enrichment center that made her cry.
Okay, okay. And did you talk to the teacher or just based on your own observations?
I try to talk to the teachers, but they have no idea. Nothing happened at school or enrichment center.
Then when did you start to bring her to the doctor?
When she complained pain, then we brought her to orthopedic because we thought she has something wrong with the legs. But then the doctor can't find anything. They just asked to rest for 1 to 2 weeks. But the next day I saw her walking condition getting worse. Then we brought.
Within the next day, so it's quite fast then.
Yes, it's very fast.
So initially you didn't bring her to the GP as usual to check whether there is anything wrong with her muscles or anything?
No, because we thought it's something wrong with the legs.
Okay. Because you identify straight away with the muscles on the leg.
Yeah. After that, we brought her to a pediatrician who's seeing her since she was born. That he solved the puzzle.
Okay. And that time she hasn't started her primary school yet, right? I remember.
Yes. She just going to enter primary 1.
So after you saw the orthopedic, what did the doctor say?
The orthopedic said they just maybe something wrong with the tissue. Then just rest for 1 to 2 weeks should be okay. They never think about the nerves.
Oh, even the orthopedic didn't know about this sickness yet, didn't mention anything about this
They
sickness.
just did the X-ray.
Hmm.
X-ray, everything is good. Then they thought it's fine.
So when did you know about this? She has this ADEM then?
After the pediatrician asked us to bring to neurologist, then the neurologist recommend us to do the MRI as soon as possible.
So you, after the orthopedic, you brought back the result to the pediatrician.
No, we didn't because it's nothing in the orthopedic.
Oh, okay.
We just tell the everything that we know. Then the pediatrician very fast. Then she said it's a nerves problem.
Okay, then that's why you went to the neurologist.
Yes.
Okay. And what were the follow-up treatments initially for her conditions?
When he was admitted into the hospital, she totally cannot control her body. So the doctor gave steroid to kill the virus and cure the inflammation. It took like 6 weeks for her to, in the hospital.
When you say she cannot control the body, is she cannot move the body, or is that the muscles keep moving by itself? What was the situation?
Yeah, actually, when she wants to lift up her hand, she can't. But when she don't want, then the hand just like move. Basically, she can't control what she wants to do.
Only the hand, not the leg.
Everything.
Everything.
Yes.
Oh, okay. So what happened after the 6 weeks?
After 6 weeks, she was discharged. Then we need to do physiotherapy daily to get back
Okay.
the muscles and the strength.
All right. Okay. Yeah, thank you again for your willingness to share about your daughter's condition. I think for the audience also, we would like to go deeper in our next segments. I think we will, what we will do is that we will post the next segments, what are the topics we are going to do, because it seems that involved from the pre-diagnosis stage and also the diagnosis after that, and then the treatment during the early stage, and now also she has gone to the primary school, right? She is in primary 5, is it correct?
Yes. Now
Yeah,
it,
so for the past more than 5 years, she has experienced the progress through different treatments. So those are the things that we are going to share more with the audience. For them, again, not only for those that experience ADEM, but also those parents that experience special treatment that need to be done for their children. I think your experience will be very valuable for them to know what are the things to prepare, what are the things to anticipate as well.
yes.
Okay, thank you, Lini. And for the audience, we will post the progress and also the next segments in our Instagram under EV610. So please watch out our Instagram. And thank you again for listening. And thank you, Lini, for sharing this. Until we talk again.
Thank you. Bye-bye.
Thank you. Bye-bye.